Assalamu alaikum and good evening. Um, so I wanted to share with you guys some of, I don't know, some of the thoughts I've been having about my back and my back pain. And I thought maybe you guys could give me some suggestions or ideas, or maybe you can relate and you hear somebody else talking about it and you feel some comfort or something. My concern is that I feel like I'm facing two challenges. One of them is like too much hope or too little hope, or not knowing where the balance lies with the hope, like should you should you feel optimism about getting better, or should you try to be more realistic? And then where's realistic, like where's that line, and then after you feel that you've achieved the realistic line, is that too little hope or too much hope? Like I've tried so many things for pain relief and things that people said would help, and so obviously now I'm skeptical about a lot of things, and I don't want to be too skeptical where I don't try something that could have worked for me years ago, but I also don't want to be so optimistic and hopeful and all of that, and then I just keep setting myself up for disappointment, because the truth is they don't really know enough to really help us with some of the problems we have, Like one doctor told me I might have fibromyalgia, but for 10 years, matter of fact, for almost 15 years now, no one has ever told me I have fibromyalgia, and I doubt that that diagnosis is true. And then there's no proof. There's no way to test and say conclusively that a person has fibromyalgia, So like, what does that mean? And what am I supposed to do? And the strange thing is that without the diagnosis of fibromyalgia, my insurance wouldn't pay for certain medications, because it said that those medications that I was trying to try didn't match my diagnosis of simple extreme back pain, you know. So now that it might be a nerve problem, it might be fibromyalgia, now they're more willing to let me try these other medications, one of which I already tried a long time ago and it worked really well. So that that leaves me in a strange situation where I have a diagnosis for something that I don't think I have, but I'm grateful for that diagnosis so that I can get the medication. But I'm also wary of having that diagnosis just accepted, because I don't really have all the symptoms for it, you know? So, but on the other hand, because it's not a disease that's well known, there's no cure for it, people don't understand fibromyalgia well, and it's only recently been accepted by the medical community. Maybe it is fibromyalgia. Maybe there's just much more to it than they know about. I feel like every time I look into like what I might have or what's going on with my body, I'm always in some rare, unique category where they're like, well, this never happens to people. I'm like, well, it happened to me, Or they're like, well, you shouldn't feel this much pain. Well, tell that to my body, you know? It's like, what are you supposed to do, And so this not having a diagnosis problem leads into the problem of having too much hope or too little hope, which leads into part of the frustration of not having a diagnosis, So I feel like it's a two-part problem. Like if I had the proper diagnosis, then I could look into the proper cures and stuff. But now I'm just scattered all over the internet looking at everything from homeopathic pellets to changing a diet to kinesiology to rolfing to chiropractic to massage to acupuncture to acupressure, and then at the same time being doubtful of all of those things because I've tried most of them before, and then it's like, is it worth trying it again? Is the second time the charm, or have things changed in my body? Are my nerves more sensitive? Does the problem feel the same, but it's actually a new or different problem? Has it developed into something else? It's just so much mystery, and it makes me feel sad, I don't know what to do about it. And one sister told me that I can't give up on believing in a cure, that Allah will cure me in this life. And I was really surprised about that because I thought that I was being good and religious by believing that Allah would not heal me in this life, but He would heal me in the next life, and that was okay, you know. I wanted to have acceptance instead of being so sad and upset about it and trying to reject it and just not being willing to accept it. So I thought, okay, if I just accept the will of Allah, that, you know, I'm going to be sick in this life, but the healing and the cure will come in the next life. That's part of developing a proper relationship with Allah, you know. But then the sister said that you have to believe in Allah and in His ability and desire to cure you and heal you in this life. And I don't know if that's true. I mean, she said, you know, you have to have full faith in Allah, and that, you know, and you have to keep asking Him and praying and believing that your prayers will be answered. And I pray, I was praying for relief, and I thought there would be minor relief and temporary relief. I just never expected it to be permanent relief. You know, even when I had my surgery in 2009, I was very doubtful that, well, I don't say very doubtful, I was somewhat doubtful that I would actually be better. I couldn't even wrap my mind around being 100% better after the surgery. And that was because I had been in pain for 10 years. Now it's been 15 years almost. I don't know what to do. So if anybody has any ideas about like what you're supposed to do and what amount of faith you're supposed to have in a cure in this life versus faith in a cure in the next life, and faith that that pain in this life is somewhat good for you because it alleviates sins, and because maybe it makes you more thankful and more grateful and more appreciative and more mindful of God, you know, is that the better point of view to have? Or is it better to be like, you know, I believe that a cure will come, and I'm just going to keep praying for that 100% cure? I don't know. And then is anybody else going through something similar where they don't have a diagnosis and they don't know what to do? And I don't know. Maybe we can encourage each other. So that's kind of my thoughts for today. I hope everybody, I don't know, finds the perfect balance between optimism and realism and some small amount of pessimism, a healthy amount. I guess that's like realism. Yeah. So, and I hope everybody gets the diagnosis that is right for them and that leads them to the right cure. And hope all goes well with you guys. And keep me in your prayers.